Yeah, that's done. Thank you. Thank you once again. Okay, somebody, every time somebody remind me regarding this YouTube, okay? Sometimes wantedly I don't put because they are special lessons. Okay, this one I can put. This is also special, but still. Okay, right. Possible relapse of complication. This is an urgent letter. So remember that one. So if you see here, there is nothing about urgent here. There is nothing about urgent here. There is nothing about urgent here. Try to understand this. That means one point is missing here. Urgency is missing. You understand? You think that this is very fine. This is people pleasing, sample. Because if quality is given, then nobody will understand it, first of all. So they will not give outstanding quality. They'll give mediocre quality. And still in that mediocre quality, still if you do mistakes, still you will pay. Okay. Mediocre quality and still mistakes. Urgency is missing. Urgency is missing. Fine. Urgency is missing. So that point is missing. Right? And requires your investigation of a possible relapse of pericarditis. So how can you improve? Thank you. I thank you. So personalization, this is a personalized letter, personalized sentence, low quality, because the person who is writing the letter is being important here. The person who is receiving the letter is in the second position, and the person who is the real patient is in the third position. It's a pity. I thank you for seeing Miss Styles. So I is important and you is important. Miss Style is the least important. What is this nonsense going on here? Is this any friendly letter? I thank you. Why I should thank you? Are you doing any favor to somebody? Personalized sentence, low quality. I thank you for seeing Miss Styles. Who requires? She requires your investigation. Active voice, active voice, active voice. Third one is active voice. Active voice. Low quality. Active voice, low quality. Active voice, low quality. So now you see urgency is missing. Personalized sentence, I, we, your personal pronouns. Avoid personal pronouns. Avoid personal pronouns. So here, then what is the treatment? This is a problem. Low quality is a problem. So improve the quality, increase the quality, quality enhancement. Quality enhancement. See, school teacher is one word. It is written 2 words here. Is it in the real exam also? Question paper, it is that? Let us see here. Yeah, school teacher. It's written 2 words. Maybe it's a devil's mistake, or maybe unknowingly they gave a mistake here in the official case note. This is from the OET official website I have taken. I'm not telling I am something great, but mistakes happen everywhere because different people have different perception. Different people have different perception. You cannot look into my mind and read what is going in my mind. Here, I'm not blaming OET here. I'm telling that even in official OET papers, there may be mistakes. That's it. School teacher is not 2 words. It's 1 word. Never. Let's see. Cambridge Dictionary. Because OET is OET. Cambridge Dictionary is even bigger than that. Okay, let us see. School teacher. School teacher is 1 word. That means what is there? There's a mistake. What is there in the official sample is a mistake. What, Simon sir, what nonsense you are talking? How can mistakes be there in official OET? I don't know. You decide whatever you want. I'm not blaming OET here. And my session is live on the YouTube. Anybody can question. This is an open challenge here. I'm not blaming OET here. I'm saying that mistakes can happen everywhere. Even when an OET official website has a mistake, then why you cannot do mistakes? That is what I'm telling. You can do mistakes. You have freedom to do as many mistakes as possible, but correct it from Cambridge Dictionary. Correct it from Cambridge Dictionary. That is what I'm telling you. There is one. Yeah. Nobody opens the video and nobody opens the audio without my permission, please. Yeah. School teacher. School teacher. Just one sentence we have taken from there. See how many points are there. You think you'll get B grade with these mistakes? Okay. Yeah. If you write as it is, so there is a spelling, there is a grammatical error. One word, not two. Not two. It should be SCHOOLTACH here. Now, why you may think Simon sir has given this one? Why I should give? Let us copy from Cambridge Dictionary directly there. Copy. And let us paste it here. Let us paste it here. School teacher is one word. That's it. School teacher is one word. This is the right answer. Okay, you cannot. So this is the way how 4 points I have given you so far. 4 points I have given you so far. That's it. Now, what is important here? What is important here? Patient is important. Whether she's a widow or not a widow. Whether she is 62 years or 24 years. Whether she is a teacher, school teacher, or she is a school attender. Or whether she is a retired person or not a retired person. Don't want. That is not that much important to go into the beginning of the letter. This is the most important thing. Okay, the doctors are very busy. The nurses are very busy. They are very special. They don't have time to go through all these things. In the first paragraph, they will see and they will decide whether it is important or not. So what is important? 62-year-old widow, that can go into the next paragraph. Retired school teacher, it can go into social history, personal history, social history. It can go in. It cannot go into the main body paragraph. Most important things. What is important? 62-year-old widow. That is important for the person who is reading. 62 or 24, that doesn't matter. Whether she's a widow or not, that doesn't matter. Whether she's a school teacher or not, that doesn't matter. Whether she's retired or not retired, that doesn't matter. Priority is the most important. Are these important? 62 years old, important, widow, important, school teacher, important, retired, important? Not at all. He is a medical professional. He is not a friend of Miss Stiles. He is not a relative of Miss Stiles. Professional relation only. So only give that one related to the profession in the introduction. Introduction is the most valuable content. And this is degraded with low quality, unimportant, not so very important. A king is a king. Not anybody can go and sit in the king's seat. What do you mean by introduction? The introduction is a briefing in a nutshell about the most important things. So thank you for seeing. Why should we thank somebody for doing his duty? Why I is important? Why you is important? Why they came even before Miss Stiles? So this is not so important. This is not so important. Not so important. A 62-year-old widow, 62-year-old age, not important. Widow, not important. Retired, not important. School teacher, not important. Okay. They're not important, and they came into the introduction. They came into how come these will come into the introduction? They can come into social history or personal history. No, all the histories you can write separately, right? Why should we send this here? Now, how can we write? Let us see. How can we improve this sentence? Next time when you are thinking, write what is important. Write what is important. Yeah. Number one, start with the name of the patient, Miss Styles. Come on. Miss Styles. Okay. Miss Styles. Finished. Then next, Miss Styles. Next, Miss Styles. So three in one sentences. So three sentences we are going to write. Now, first one is, what is her condition? And what is your requirement? And what is the state? So three things you'll write. Miss Styles Miss Styles has symptoms suggestive of pericarditis relapse. Yeah. Miss Styles has symptoms suggestive of pericarditis relapse. That is one. We are talking only about Miss Styles. Don't talk about I, don't talk about you. That is nonsense. Sir, everyone is writing, I am writing to refer, I am writing to discharge, I am writing to update. That is a standard. No, that is not standard. That is ready-made food for the useless fellows, ordinary fellows, simple fellows. Those who just try to fail. Just try to fail. Okay. Try to understand what I am telling you. Okay. You, all the people who are studying are not just mere wastage. They are special. They are extraordinary. They want to do something great. They want to do something great, extraordinary. So what you have to do is you have to try to excel. Every student is excellent. Okay. People who are teaching something nonsense. It doesn't mean that it is perfect. See, for example, a teacher tells something, students listen. Why? They trust teachers. And if teachers only give wrong measures, then no problem. What to do then? They are helpless. They don't know. Okay. So don't trust any teacher, including me. Don't trust me by any way. Trust OET. What OET is telling, trust it. OET is telling. So OET gave the sample. No, sir, this is right. Yes, it is right. It's okay. It is okay means it's ordinary, usual, common, simple, general, normal, everything, whatever you say, mediocre. It's okay, but it's not perfect. Remember that. It's not perfect. It's not better. It's not the best. It's just okay. That's the point. Remember that. Tell me. Sir, sorry. Sir, Miss Styles has symptoms suggestive of pericarditis relapse. What is her condition now? What is her condition now? You have found the signs and symptoms. Okay. Miss Styles has signs and symptoms suggestive of pericarditis relapse or complications of pericarditis. That's it. That is sentence number one. Present condition. Present condition. Next one is Miss Styles requires investigation, not okay, not just investigation, urgent, emergency, on an emergency basis. That is missing there. Okay, requires urgent admission and a definitive diagnosis Okay. To confirm of the same, whose signs and symptoms suggestive of pericarditis requires urgent admission and definitive diagnosis. Definitive diagnosis. Finished for the same thing. That is tentative diagnosis, preliminary diagnosis, and she requires a definitive diagnosis. Okay. One sentence you learn now. One sentence. And based on this sentence, you improve your quality. Quality is more important. Quality is more important. The next one. Miss Stiles requires urgent admission and definitive diagnosis. That is second sentence. Next one is, what is this letter? Is this a referral letter or a discharge letter? What type of letter it is? You see here. Okay. Your nurse routine follow-up care of the patients after his recent hospital discharge. So you are following up the patient's recent hospital discharge after the patient discharge. Okay, fine, at home. So next one is here. You are write a referral letter. You are writing a referral letter. So Miss Stiles is being referred. Finished. Miss Stiles is being referred. Miss Stiles is being referred. So three things. Three things. Now, these three sentences you can make into one sentence. You can make into one sentence. Eliminate this one. This is repeated. Eliminate this one. This is repeated. Miss Stiles, comma. Okay. So now let us see. So this Miss Stiles, Miss Stiles, Miss Stiles. Will 3 times is there. It's 3 times. So we'll take only one time. Miss Stiles, comma. Then we'll take the first one. Other things are not important. Right in the next paragraphs, no? Those who don't know quality, they will do anything they want. You know quality, you do it. I'm least bothered about many others. Okay, they are sheep. They follow blindly. You open your eyes, remove the cataract and clear that one and try to learn. I'm showing with proofs, no? I'm showing with proofs. This is useful. That is useless quality. This is useful quality. Extraordinary quality. That's what I'm telling you. If you're interested, you learn. If you're not interested, just take your own decision. I'm not forcing anybody. Okay, I'm not forcing anybody. This is what comes quality from me. I want to learn. I want to learn. You learn or not, that is not my problem. I want to learn how to teach extraordinary things to you. I want to be the best and I don't want to be second to none. So I try to give you the best. Whoever is interested, you can go ahead. So Miss Stiles has the signs. So here we'll put who. Miss Stiles, who has signs and symptoms suggestive of pericarditis relapse, comma. This one has come here. Once again. So Miss Stiles, comma. Let us take from here. We are taking this one and putting it here. First sentence we are putting here. Miss Stiles, comma. And here we are putting relative pronoun who. Miss Stiles, who has signs and symptoms suggestive of pericarditis relapse, comma. Next, you bring this one. Is being referred. Bring this one here. Is being referred. Bring it here. Now, remove requires. Remove requires because is being referred is already there. If is being referred is not there, then you use that one. Is being referred for urgent admission and definitive diagnosis. Finished. So now see here and see here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 12, actually 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. 22 words are there. The length is almost the same, but the word count you see. Miss Stiles 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. That's it. So now try to understand here. The word referred is not there here. It's a referral letter and the word refer is not there. The missing referral. How do you understand that this is a referral letter? This is a referral letter. How do you understand? How do you understand without the word referral? He's asking you to write a referral letter and it's confusion. It's confusion. People cannot understand. The person who is reading this one cannot understand when there's a referral letter or a discharge letter or a transfer letter or what it is. We don't know. When you open the letter itself, he should see the first paragraph and he should know what type of letter it is. Referral letter, not there. Urgent letter, not there. And you think you are going to get results with this? I don't know. You agree or not, that is not my problem. You agree or not, that is not my problem. What is the fact? The fact should be as it is. I don't want to distort the fact. I don't want to distort the fact. So how many of you agree with the suggestions which I am giving you? Just to say agree. If you disagree, say disagree. No problem. No need to please me, okay? Be frank. Be straightforward. Be correct. No need to cheat your conscience. If you agree with whatever I am saying, if you understand, yeah, sir is telling something which is real, I feel, then you say, I agree. Say agree. If you want to say agree, you just say A. If you want to disagree, just to say B. That's it. That's it. So I'm telling you what is quality. Why people fail, I'm showing you very clearly. I'm not like others who just, okay, very good, excellent, you write whatever you want. No, I cannot say that. I cannot say that. Okay. Yeah. Don't expect that ordinary quality from me because I want to be special. I'm not special. I want to be special because you are special for me. Don't force me to give ordinary quality. Learn. Yeah. So that's it. Just a type A or B. Just 1 second. No problem. Even if you say B, I don't keep all these things in my mind. I don't keep personally anything. Okay, I'll just tell openly, I'll talk. So this is how it is. Almost same. Thank you for seeing Miss Stiles, a 62-year-old widow and retired school teacher who requires your investigation of a possible relapse of pericarditis. How many words? 1, 2. Thank you for seeing Miss Stiles, a 62-year-old widow and retired school teacher who requires your investigation of a possible relapse of pericarditis. 22 words. So these are 22 words. 22 words. Now here, how many words? Miss Stiles, who has signs and symptoms suggestive of pericarditis relapse. Miss Stiles, who has signs and symptoms suggestive of pericarditis relapse, is being referred for urgent admission and definitive diagnosis. 20 words. What makes the difference? See, you can see the difference. 2 words are less and all the unimportant things are removed and all the important things are put there. All the unimportant things are removed and important things are put there. So do you think which is quality now? So this is sentence A. I'm not telling this is wrong. I'm not telling this sentence A. Sentence A. Okay. I'm not telling this is wrong. This is okay. This is okay. It's not wrong. It's not wrong. Only the quality is poor. Okay. The quality is poor. And here, sentence B. What all I have shown the flaws: urgency, missing, personalized sentence, low quality. Now this is high quality. Active voice is there. Here is being referred. Passive voice. Passive voice is being referred is passive voice. Okay. Is being referred is passive voice. So that is what it is. The next one. Referral letter. Referral. The word referral is not there in the first one. Sentence A. Referral has come here. Referred. Referred is there. Urgent letter. So this is an urgency missing. But here urgency is there. Here no urgency. Here no urgency is not. When the person reads that it is an ordinary letter, there is no urgency. Then why he will act fast? Okay. When you read the letter, oh, this is urgent, immediately. That's it. When he sees the letter and reads the interaction, oh, this is urgent. Remaining he will read. First, get everything ready like that one. Urgent admission and definitive diagnosis. So this is how we are going to write. There are many styles. This is not the only one style. There are many styles. So first one, urgency is missing. We have put the urgency. Personalized sentence, I, you, all removed. Okay. I, you, all removed. And here, your also is there. Your investigation. See, that is also unnecessary. Remove. Here, there is nothing your here. Is being referred for urgent admission, not your investigation. Okay, your is not there here. Personal pronouns are removed. Okay, active voice. Here, active voice. But here, requires your investigation of a possible relapse. Here is being referred. Is being referred is passive voice. Here it is active voice. Okay, he requires. Here is being referred. So passive voice. Then next one is referral letter. Here is being referred. This is there. This is green. This is green is being referred. Urgent letter. Urgent. There is no you. There is no I. There is no your. There is nothing. Okay. And active voice is removed and here passive voice is there. And here personalized sentences I, we, you. That is not there here. Here urgency is missing. Here urgency is there. Here referral letter is there. Missing. Here referred is there. So how to improve the quality? How to? So if official OET letters are only this quality, then what about the people who are teaching you? Okay. I'm not telling that is not right. They are also right. But quality is low. If you go to a supermarket, and if you go to a street side market, and if you go to a local market, what is the difference? Street side market is, you know what is street side market. Lot of rotten things will be there. And local market, certain level of rotten things will be there. But if you go to a supermarket, not even one single tomato will be rotten. That's it. That's called quality. They charge extra, but they give quality. So if you give quality and remove all the rotten things from your presentation, you will get extraordinary marks. That's what it is. Okay. So now I'm asking you, how many of you are with me? Okay. The next question is, are you, one second. Are you with me? Respond me with yes or no. If you are with me, I'll give you one more sentence. If you're not with me, I'll stop here. I just want at least 7 yeses out of 14. More than 50%. 7 yeses I need. If you have given yes, that means you learned one quality sentence. If you say no, that means you don't want quality sentence. So if at least 7 people say yes, then I'll give another sentence like that. Out of your interest, no? I want to teach, but whether you are interested, this is my special class. Nobody can say no. This is a free class. This is a special class and nobody is paying for this class. Remember that. Okay. This is the where I can prove that I am a good teacher. I cannot be excellent. No doubt I cannot be excellent. I can prove that I am a good teacher. That's all. Okay. There are many nurses and doctors who are teaching excellently. So I cannot compare myself to them because they are teaching extraordinarily. And I am an ordinary teacher and my quality is ordinary. If you want this ordinary quality, then I am with you. That is what I mean to say. Right. Next. Yeah. So one sentence we have learned. First sentence. Now what I want you to do is you write any example, change the name, change this one, change that one, change anything and write one sentence like this. I'm giving you 3 minutes, 4 minutes. Write one sentence like this. Instead of Miss Stiles, Mr. Wilson, Mr. Lincoln, something else, or Mrs. Margaret, whatever you want. Okay, you can take that one. And instead of signs and symptoms, who was diagnosed with, take any example you want, but write one sentence in your notebook and then correct it, improve it, learn that one and give it, because we are learning together. I'm giving you 4 minutes, one sentence. I have explained you like that. Is being discharged or is being referred or is being transferred, change it. Urgent or not urgent, admission, or appropriate management, ongoing care, appropriate management at your facility, following the discharge tomorrow or today. Write any one sentence, whichever you want, no problem. Whichever you want. Change the name, change the place, change the disease, change the type of letter, change whether it is urgent or not, whether it is ongoing care or appropriate management or whatever it is. Okay, you can change accordingly. 4 minutes. Sorry, okay. Yes, yes. Okay. Okay. Yeah. Yeah, I'm going to stay online for maximum time from today onwards. As much time as possible, I'll be staying and get benefit from that. So 4 minutes. Yeah. Miss Berito, who has signs and symptoms suggestive of lung cancer, is being referred for emergency admission and appropriate manner. Wow, wonderful sentence. No mistake at all. Miss Berito, Berito spelling mistake, I think. Check Maimuna. Who has signs and symptoms suggestive. I'm like this only. I cannot leave any mistake. Berito, check the spelling. Berito or Berito. Double T or single T, check. Rewrite if it is double T, rewrite with double T. Miss Berito, who has signs, I remember I have corrected the letter somebody's. So it was double T, I feel. Okay. Who has signs and symptoms suggestive of lung cancer, is being referred for emergency admission and appropriate management. Very good. Okay, the same sentence, you can also write like this. The same sentence, you can also write like this. Whose signs and symptoms are suggestive of. So like that also you can write. So the second style, Miss Styles, whose signs and symptoms are suggestive of. This is also right. Mrs. Joseph, who has symptoms suggestive of severe migraine, suggestive to severe migraine, suggestive to severe migraine. Miss Bell, Miss Joseph, who has symptoms suggestive. Symptoms suggest severe migraine. Suggestive to will not come, suggestive of. Severe migraine is being referred for emergency neurological assessment and proper treatment. Full stop. Full stop is needed, Nasra. Full stop is needed. Suggestive of, two corrections. Make two corrections. Okay. Miss Bell, who has unstable diabetes mellitus, who has unstable mellitus, who has had unstable diabetes mellitus. Okay. Who has means only now. Who has means only now. Who has unstable diabetes mellitus. Okay. Because continuity of care and social support following hospital discharge today. Okay. Ms. Bell, who has unstable diabetes mellitus, was admitted 3 weeks ago. Requires continuity of care and social support following hospital discharge today. Okay. Thank you for receiving Mr. Smith, comma, who has signs and symptoms suggestive of asthma. When you say thank you, then you cannot join this. He need ongoing care. You cannot write. And put a full stop and say he needs, not he need, Veronica, he needs ongoing care. Manjula, Mr. Perlita, comma, after comma space is needed, who has signs and symptoms of ulcerative colitis, comma, space is required, is being referred for further investigation and appropriate treatment, full stop. Full stop. Very good. Yeah, come on. Yeah. So now we'll go for the second sentence. We'll go for the second sentence. Yeah. Now, second sentence you can take from medical letter. Yeah, here is medical letter. Oh. Yeah, this is a doctor's letter. Nasra, Mrs. Joseph, symptoms suggestive of severe migraine, is being referred for emergency neurological treatment and proper treatment, full stop. Very good. So now second sentence, sentence number 2. Sentence 2. Yeah. Yeah. So he first presented to me a month ago, complaining of new onset indigestion, which has not resolved despite himself medicating with antacids. Okay. He first presented to me a month ago. Okay. So how can you improve this one? A month ago, date, always forward, month ago, comma, a month ago, comma, he. Why you want to write every time he, Mr. Knowles, Mr. Knowles, Mr. Knowles? No need. So, okay, you can also write he, see? The official letter, no problem. If you want to write, you can write like that also. But no need to write that also. A month ago, during the initial visit, comma, okay, is first presented during the initial visit. A month ago, came forward. He first presented during the initial visit. Okay. New onset indigestion. New onset indigestion. Okay. Comma. Which remained unresolved despite self-medication with antacids was reported. Finished. See the sentence almost the same. Active voice is removed and passive voice is there, which had not resolved, which remained unresolved. Not resolved became unresolved. See here, two words is brought into one word. Two words became one word here, unresolved. That is one. Okay. Despite him self-medicating, him, this is removed, him, gone, he, gone. He is not there, him is not there. See the quality, improvement. Huh? Complaining, reported. Okay, complaining of, presented, complaining of. Presented, I made it visit during the initial visit. Okay, during the initial visit. Right. Self-medicating with a self-medication I made with antacids was reported, which remained unresolved despite self. New onset, comma. New onset indigestion was reported. That's it. New onset indigestion, which remained unresolved despite self-medication with antacids, was reported. You can break it into two sentences, or you can write in one sentence like this. If you can do like this, you do like this. If you cannot do like this, do in your own style. Okay. A month ago, you say a week ago, last week. Okay. During the initial visit, new onset indigestion, which remained unresolved despite self-medication with antacid, was reported. You see, passive voice has come. He is gone. Him is gone. Self-medicating became self-medication. Okay. Instead of presented, we wrote visit. Instead of first presented, initial visit. Okay. Not resolved, which had not resolved, remained unresolved. Okay. Despite self-medication with antacids, was reported, complaining. He was complaining. So was reported. Okay. So this is the way how you can improve. So take the second sentence now. A month ago, came forward. That's the improvement. Yesterday, I went to the park. I went to the park yesterday. Doesn't seem improved. Yesterday, I went to the park. Last week, so this is called time framing. The people think. Last week means immediately people will think, oh, last week. So which is more important, you have to bring forward. A month ago is more important. Time setting. Okay, they'll mark you. They'll make you think. Yeah. Write your own sentence like this. Nasra Muhammad, Mrs. Joseph who has signed symptoms suggestive of severe migraine is being referred for emergency neurological treatment and proper treatment. What is this Nusra Muhammad? Neurological treatment and proper treatment. It's a proper neurological treatment. Enough, na? Treatment. Why you are repeating the word? Make it corrections. What is this Ma styles? Hamid. Nofa Hamid. Ma or Miss? Styles, yes, capital letter is there. Rewrite. And before comma, space is not required. Miss Styles, comma, Mr. Miss MS small s, capital S Styles. After Styles, comma, space is not required. Who was diagnosed with lung cancer? Again, comma, before comma, no space is being referred for relevant investigations and appropriate management. Yeah. Don't say sorry, sir. Why you want to say sorry? I don't understand. It did not do any harm to me. They are learning. So next, let us take one letter from nurses now. Nursing case notes. Yeah. So this is the sentence. Third sentence, sentence number 3. Sentence number 3. Sentence number 3. So, after comma, space should be there, no far. Before comma, no space, but after comma, space should be there. Okay. Put a space after comma. Both the commas put space. I want to see again. Mistakes are mistakes. I cannot say yes, okay. Rewrite and submit. And you know, doctors will be punished more than nurses. Now next. Yeah. Ms. Stiles, who was diagnosed with lung cancer, comma, is being referred for relevant investigations. And now no mistakes. Very good. Yeah. Ms. Stiles has hypertension, diabetes type 2, and depression, managed with quinapril 40 mg twice daily, metformin 500 mg twice a day, and gliclazide 30 mg daily. Many people, what they do is, everywhere they put comma. Quinapril, comma, 40 mg, comma, twice daily, comma, metformin, diabetes, comma, 50 mg, comma, twice a day, comma, like this. They will make a nonsense of everything. Be careful. Don't do like that. Okay. Now, we are improving this sentence. Okay. Miss Stiles. So diabetes and hypertension both also not for now only. Hypertension is long. Diabetes is also long. Depression is also long. It's a continuing process. It's a never-ending process. Long, prolonged sickness or ailment or disease. Miss Stiles has had hypertension, comma, type 2 diabetes, mellitus, and depression. Okay. So we have taken that one. Miss Stiles has had, means for quite some time. Not has means now only she has. Has had means for quite some time. Tense is very important. Has means I have a pen. I have a pen. This is a pen. I have a pen means now. That means yesterday, maybe I did not have. Tomorrow, maybe I'll not have. I have two sons. Yesterday, today, tomorrow. Have means is universal. Okay, always. So when you say has had means for quite some time. I have had this mobile. I have this mobile now, but I have had this mobile for the last 1.5 years. Okay, present perfect continuous tense. Right. Present perfect tense. Sorry. So Miss Stiles has had hypertension. Now let us go to the case notes. Hypertension. There is hypertension. Yeah. Hypertension. 2011. Diabetes mellitus 2013. Depression 2016. Why you did not write this? Why OET you did not write this? Means that is not important. Do you think that they are not important? Diagnosed. 2011, hypertension, diabetes mellitus type 2, and depression. Okay, has had hypertension. You can put it in brackets here, put it in brackets here, put it in brackets here. Then hypertension is when we can put it in brackets here. So 2011, 2013, 2016. Okay, brackets 2011. You can put like this also. 2013 and depression 2016. Like this you can write. Or, okay, you can remove those things. Miss Stiles has had hypertension, type 2 diabetes mellitus, and depression since 2011, 2013 and 2016. Okay. So now this is since 2011. Miss Stiles has had hypertension, type 2 diabetes mellitus, and depression since 2011, 2013 and 2016 respectively. So that is it. And the treatments were quinapril, okay, and then metformin plus gliclazide, depression. Okay, so nothing is there for this one. Managed with these things: acupril, quinapril, acupril. You can see somewhere. Quinapril. Yeah, here acupril, Diabex, and apogliclazide. These things you can write. Okay. The present condition. Okay. The present. Currently, he is on the current medications include acupril, Diabex, and apogliclazide MR. Okay, acupril, Diabex, and apogliclazide MR. Okay, right. So the current medications include Dactopel, Diabex, okay, and apioglycoside MR. So this is the way how you are going to present. Ms. Stiles has had hypertension, type 2 diabetes mellitus, and depression since 2011, 2013, and 2016 respectively. The current medications include, okay, or you can say like this, since 2011, 2013, and 2016. Yeah, comma. So you can put like this. Since 2011, 2013, and 2016, Ms. Stiles has had hypertension, type 2 diabetes, mellitus, and depression, which were effectively managed with Acupil, Diabex, and apioglycoside MR. See the quality change. See the quality change. Word length less, quality improved, and extra information is needed. That also we have given. Years we have given. Okay. So metformin, Diabex. Why? Two things. More important is generic name. Okay. Generic name more important than what is brand name. We are writing brand name. Diabex means metformin. Okay. And apioglycoside MR means glycoside. Okay. Acupil is brand of quinapril. So we are writing brand names. They can easily understand. He's a doctor. So why do you want to write two names when you know that the brackets, the Diabex is more important? It's not any metformin, it is Diabex. Diabex is specific name. For example, anybody calls me, for example, sir. Everyone call me sir, but some people only call me Simon. So that means they know my personal name. So when they know me, they will not call with ordinary name. No, they'll call with my special name. Okay. So like that. So for example, somebody calls you nurse, but some people who are very close to you, the patients will call you by your name. So they have close relation with you. That's the point. Yeah. Meera Manoj, Miss Stiles has had hypertension, comma, no space before comma, space after comma. Rewrite that one, Meera Manoj. And Miss Stiles has had hypertension, comma, then space. Diabetes type 2, mellitus, diabetes mellitus type 2. Write full. Okay. Because words are also important. Na? If it is going word count more, then you can cut. Diabetes type 2, diabetes mellitus, and depression since 2011, comma, space 2013 and 2016 respectively, which were managed with, effectively is better. Effectively managed with. That's correct, no problem. Quinapril, Acupil, 40 mg twice daily for the former, F-O-R-M-E-R, former. You have written very nicely for the former, and metformin 500 mg twice daily, and apioglycoside for the latter, L-E-A-T-T-E-R, latter, former and latter. Former means the first one. Former means the first one. If there are two things, but here there are three things, so you have to amend a little. The former means the first, sorry. The former is equal to the first one, the first of the two. And then next, the latter is equal to the second one. The second of the two. Two people are there. The former is the first one, the latter is the second one. The former is the leader and the second one is the follower. The latter is the follower. There is a leader and a follower. The former, the two people are going in the low. The former is the leader and the latter is the follower. Latter means second one. Very good. So if you write like this, two words, former and the latter, what is the quality of those words? Yeah. So the former means it's B1. or of in an earlier time, before the present time or in the past. That is not our point. Former means the former, B2, the first of the two people. The first of the people, that's no problem, no problem. The first of the two people, things or groups previously mentioned, that is the former. B2, but quality is together, former and the latter, quality is improving there. The former, okay, student of the stated class group. Former group means earlier group. The latter, okay, the latter is also B2, near or ends to or something. The second of the two, the second of the two people, okay. So 3 sentences we have learned now. 3 sentences. So far 3 sentences. Okay. Now you prepare your own sentence like this. Take your own sentence. Anything you can write any way you want to write, you can write. 3 sentences. So far we have learned. So far as capital letters. So far, comma, we have learned 3 standard sentences. No doubt that is good. We have improved that one. Why 2 names? 1 name is enough, no? Huh? Mr. Peter taught us English grammar. Mr. Peter, the teacher, has taught us English. Why 2 things? You don't know my name? Just say teacher taught us English. You know my name? Says Mr. Peter taught English lesson. That's all. Like that one. So 3 sentences I have given you so far. Write these sentences and keep them with you and try to use them in your own styles. So when 2, 3 different things are there, you have to write like this. The next one. Now 3 sentences over. Shall we learn another 3 sentences? Okay. If your answer is yes, okay, or no, okay, right, yes or no. I need at least 7 sentences, 7 yeses to continue. Don't tell me, sir, don't teach in the morning, don't teach in the afternoon. This is my wish, I am teaching, okay? This is out of my happiness, I am teaching. Nobody asked. If you cannot attend the session, no problem. You can watch the YouTube later, but don't tell, sir, don't teach in the afternoon, please. If anybody says don't do no, I will do like that only. That is my nature. I'll do more. Yeah. So Manjula, count the number of yeses. Are there 7? I need 7. Yeah, others type your sentences, please. How many yeses are there? Count and let me know. I need 7 yeses at least. 7 yeses are there. Then we'll go again. Another 3 sentences. Keep these sentences and learn these sentences and learn the styles of sentences. And keep these sentences in front of you. When you have a case notes, you keep them in front of you and practice. First, roughly you practice. Take different case notes. And I'm going to juice land this crown. Yeah, the cans double this was there. Huh? Okate apple. Okate pineapple. Yeah. So, okay, how many yeses are there? Okay. So there are more than 7, I think. No problem. Mira Manoj, Miss Styles has had hypertension, diabetes mellitus, mellitus, spelling mistake, double L, mellitus, double L, rewrite with double L, type 2, and depression, hypertension, comma, diabetes mellitus type 2 and depression, comma is missing after hypertension. Then diabetes mellitus, double L is missing. And depression since 2011, 2013, and 2016 respectively, which were effectively managed with, after with no need comma. So third mistake, quinapril, acupril, 40 mg twice daily for the former, and metformin Diabex, metformin space bracket Diabex 500 mg twice daily, and apioglycoside for the latter. Yeah. So you can write like that also. So here you can say measurement also you can give 500 mg twice a day. Okay, 500 mg, and acupril 40 mg, acupril. So here you can write 40 mg, 40 mg, 40 mg, comma, Diabex 500 mg, Diabex 500 mg. I'm not writing daily everywhere. Okay, apioglycoside MR, and that is 30 mg, 30 mg, 30 mg, which were effective managed with daily dosages of acupril 40 mg, okay, twice, metformin twice, apiglobulizid daily, that's all. Managed with daily dosages of acupril 40 mg twice, diabetes 50 mg twice, and apioglycid MR 30 mg once. That's it. Daily dosages of acupril 40 mg twice, Diabex 50 mg twice, and apioglycid even still improved. Okay, the quality has gone even beyond the earlier time. Mira has written that one, so again I brought it there. So actually I missed that one, I forgot that one. That is important, the quantity is important. So I forgot that one, I brought it back. Yeah, mistyles. Yeah, brand name is prefer more. Generic name everyone knows. Brand. See, when there are, for example, if I call you doctor, okay, I know your name. Why don't you call me my name? Why do you say doctor? You tell. Then I already know your name. Okay, because that's it. I cannot call you doctor. I call you by your name, Maimuna. That's all. Okay, so that's it. So, and that is more important. Okay. See, for example, you're a woman. Nobody will like you to be called as a woman. A woman come means you'll get angry, right? So if you doctor come here, so you will be very happy. When somebody calls Maimuna come here, you'll be even more happier because that fellow is very closer to you. Okay. So the distant name you use, the farther you are, the closer you are when you use special name. So brand name means you are a specialist. You know brand also, not only generic name, but you know specific name. Okay. For example, if I call you doctor, that means I am an ordinary person for you. If I call you Maimuna, that means I am a special person for you. That's it. You want to be special or you want to be ordinary, that depends on you. So if you want to be special, if you want to get excellent marks, use brand names. If you want to get ordinary marks, use generic names. That is also right. This is also. If I call you doctor also, it's okay. If I call you Maimuna also, it's okay. But what you prefer me to call you? You want me to call doctor? That means you are becoming ordinary for me. That's all. Special people will be called by special names. Ordinary people will be called by ordinary names. That's all. Next one. My Styles has had hypertension, depression, and diabetes mellitus type 2 since 2011, 2013, and 2016, respectively, which were managed effectively with acupril 40 mg twice daily, apioglycoside, and Diabex 50 mg twice daily. Apioglycoside is once daily, not twice daily. So you made a mistake. Once daily. Epiglycoside once daily. 30 mg once daily. It's only once, not twice. So that's it. You have to be little careful. And let me check. This also twice daily. This all no. This is once only. Epiglycoside once only. Yeah. So we are moving to. So all of you write one sentence like this. Write one sentence. How to write medications? I have shown you now. How to write the introduction? I showed in the first sentence. And how to write about this one, second one. Okay, presentation. I showed second one. Third one, I showed you how to write medications. Yeah, Sangeeta, sir, I have one question. Because Miss Stiles is taking medication currently and daily, then it is correct. Which word? Please clarify my doubt. Doubt spelling DOUBT. Okay. It is correct which word? What is correct which word? Yeah. Which have been. Yeah, thank you. Which were managed till now, but which have been. Yeah, just 1 minute. Which have been. Very good. Thank you very much, Sangeeta. Which have been effective for a long time. Nah? Have been. Very good. You have reminded me that one. Which have been. That was a mistake on my side. I did not notice that one. So Mira has shown me that you have to write that medications. Yeah, we know that one, but sometimes we miss those things. Nah? And we are focusing on many things we sometimes miss. So which have been for a long time, nah? Since 2011, 2013 and 2016, they have been effectively managed. Yeah, which were managed also is correct, but still managing, no? So that is also correct, but this is more correct. This is more correct. They were managed effectively till now. That's correct. Okay, which have been also is correct, which were also correct. Which were means till now. Which have been means from that time to this time. That's it. So which were managed means simple past. Which have been means present perfect. Both are right. You can write in simple past, you can write it in present perfect, but present perfect is more appropriate because we are saying since. Yeah. We are human beings. We have some mistakes, which were also is correct. Yeah, right. Which were all, but the meaning is implied is just, that's what I'm telling. The meaning implied is we are talking in simple past tense. And here we are talking in simple present perfect tense, which have been effectively managed means you're talking about the long duration, which were means just in the past like that, which were managed in the past. Have been managed means from that time to this time. That is the meaning. Which were managed means in the past. It's without timing frame, in the past. Both are right. So quality has increased even further. I'm telling you, there are many varieties of writing. You can write in number of ways, but the way how you are writing should not get confused. Learn one style, that is better. Next, come on, write down sentence. Next sentence number 4. Now we'll go for the medical letter. Medicine letter. So he drinks socially. He drinks socially. Small sentence I am taking. He drinks socially. He drinks socially. This is sentence number 4. What, sir? So small sentence you have taken. Why, sir? What is the use of this sentence? You don't know what is the use of. He drinks socially. Very simple sentence. Why? How to improve this one? So this is he. Personal pronoun is there. He drinks socially. This is active voice. Okay. There is no chance of passive voice. Then 3 words and very ordinary words. Consumption, alcohol consumption on social occasions has been reported or informed, notified. Alcohol consumption on social, again, see, I made a mistake. I told on, but again, alcohol consumption on social occasions has been reported. Alcohol consumption on social occasions has been reported. Yeah. So now, he is a non-smoker. There no need to write. He's not a smoker. So why should we write smoker, non-smoker? Don't write. Don't use the word. Okay. Don't use the word non-smoker or smoker. Non-smoker means you need not write. And smoker, you're labeling a person. Smoker. Okay. Cheater. Thief. Like that, you're labeling something. Don't use that labels. Labels, they hurt people. Labels hurt people. So don't use labels. Tell them. Tell what they are doing, but don't label them as he smokes regularly, you tell. But he's a smoker, he's a non-smoker. No need to say like that is a label. Smoker is a label for a person. He smokes is an activity. Talk about the activity. Don't talk about the person there. Okay. And don't use non-smoker means no problem. So then why you want to write? Non-smoker means no problem at all. So why do you want to write that one? If he smokes, then write. Smoking is a problem. So smokes, then write. Otherwise, don't write. No? So this is not necessary at all. He is a non-smoker, not necessary. Okay. This is a normal sentence. Okay, it would be grateful if you could see. I hate this sentence. I don't know why. Sentence number 5. Okay. Sentence number 5. I would be grateful. Why should I be grateful to you? I am an equally medical professional. You are a nurse or a doctor. I am a doctor. I am writing to another doctor. Why should I be grateful to him? Why should I beg him? Why should I request him? Is he something great and I am nothing? Why should I be grateful to him? Why I and why you? And why he? I 2 times I, 1 time you. Why? I would be grateful if you could remove this phrase at all. I don't like this one. This is, I would be grateful if you could see. Why? Why we are begging? Why we are requesting? We are equally important professionals, whether nurse or a doctor, whoever it is, everyone is equal. There is no question of difference in this indifference. There is nothing like that. I would be grateful if you could see Mr. Knowles at your earliest convenience for an endoscopy and assessment, as I am concerned about the possibility of cancer, pancreatic cancer. Possibility. So definitive diagnosis you can use. Definitive diagnosis you can use there. So why Mr. Knowles again? Avoid Mr. Knowles. Why so many times Mr. Knowles is coming? Avoid it, na? Okay. Based on the aforementioned circumstances. Based on the aforementioned circumstances. Based on the circumstances cited above, considering the above mentioned circumstance, there are many ways of writing. You can write anyone. I'm just giving you an easy one so that you can learn. Considering the above mentioned circumstances, that also you can write. Based on the above mentioned circumstances, based on the aforementioned circumstances. having considered, after considering the aforementioned circumstances, number of ways to write. There are 100 ways I can tell you. You write your own style. If anything is there, mistake, I'll tell you. Otherwise, learn one simple style. Based on the aforementioned circumstances, comma, based on the aforementioned circumstances, comma, a definitive diagnosis what is this, urgent letter or what? Urgent referral. Yeah, I know that. Urgent referral. Urgent. Emergency. Okay. Immediate admission or emergency admission. Emergency assessment. A definitive diagnosis. And an endoscopy if required to rule out the possibility of pancreatic malignancy or to confirm. Okay. Immediate or emergency as evaluation and emergency evaluation, that means diagnosis or emergency assessment or a definitive diagnosis, emergency admission, emergency evaluation and a definitive diagnosis. So based on the aforementioned circumstances, emergency evaluation and a definitive diagnosis would be profoundly beneficial. Okay. So based on the aforementioned circumstances, emergency evaluation and a definitive diagnosis would be profoundly beneficial. So like that you can write. In addition, to an endoscopy if required. So, based on the aforementioned circumstances, emergency evaluation and definitive diagnosis would be profoundly beneficial in addition to an endoscopy if required. Okay. So, however you want to write, you can write. If you think this is important, you write this one. If you think that is important, you write. So, based on that one, there are many people writing in many different ways. Okay. To rule out the possibility of pancreatic, to rule out the possibility of pancreatic cancer. Whichever you want, you keep. Whichever you don't want, you leave. Okay. So based on the aforementioned circumstances, emergency evaluation and definitive diagnosis would be profoundly beneficial, in addition to an endoscopy if required, to rule out the possibility of pancreatic cancer. So he's saying, I'm concerned about this, as I am concerned. Okay. But we are saying to rule out the possibility of. So anyway, you can write twist and write. That's already given one style. I'm giving another style. Whichever you feel comfortable, you use. Whichever you make an amalgamation. That and this you mix up and try your own style. Don't copy paste things. Try to take your own style. Try to take your own style. Yeah, write one sentence of your own like this. In view of the aforementioned circumstances, comma, very good. Organizing urgent transfer. Organizing an urgent transfer. A transfer. An urgent transfer. A referral. Like that. And providing care. Organizing an urgent transfer. And providing care. Providing appropriate care. No, something is missing here. It's not just providing care. It's a definitive diagnosis you are sending there. That is missing. Okay. Would be profoundly beneficial for mistypes. Everything is correct. But the thing is, emergency part is missing. And why are you sending that? You have to repeat that point. Okay. Emergency evaluation or a definitive. There in the introduction, if you had said emergency evaluation, here you said definitive diagnosis or urgent assessment. Something you change and you rewrite the same thing. Yeah. So write down one sentence each, please, in the similar fashion. You write your own sentence, na? So 5 sentences I given. Small also is good only. Okay. Small also is good only, no problem. Those who are on the YouTube, once again, I'm telling you, okay, if you are interested to join in the classes, you can join, provided you give me time. Join my sessions. If you don't want to give me time, please don't take admission with me. If you want to learn English and then excel in OET, join with me. We don't want only to pass OET. Why you want there? Many teachers in the world. Simon is an ordinary fellow. Okay. No need Simon. Yeah. Marinang Makoko. Based on the aforementioned circumstances, immediate assessment and proper management. Instead of proper, you can say appropriate, would be profoundly beneficial. Come on, write down your sentences, please. Like this 12 sentences, you learn enough. Yeah. So now we'll go to the nurses again. Sentence number 6. Sentence number 6. Oh. Sentence number 6. I'll go to nurses later again. In view of the aforementioned circumstances, organize an urgent transfer and evaluation of Mrs. Styles. Yeah, here Mira has given a point which can be corrected, all of you. Mrs. Styles, when there is an ending with S sound, you need not put another S. Just to put apostrophe S. Apostrophe, that's all. No need S. Because if you put S apostrophe S, it becomes sound. So Miss Styles, recurrence of symptoms. Recurrence, double R E N C E, not A N C E. Recurrence, E N C E, not A N C E. Write it 10 times. Everyone who does mistakes, everyone. Okay. Everyone who does mistakes, write 10 times so that you will not do those mistakes again. It's okay to write 10 times rather than lose your mark in the exam. Afterwards, it is your wish. Don't get upset anyone. What, sir, like LKG, UKG children, you are asking us to write 10 times. Don't think like that one. I believe that you will follow me. That's why I'm telling you. You are my students. If I don't tell you, will I go and tell somebody, neighbors? No, no. My children only I will tell, thinking that my children will listen. Okay. I cannot go to the neighbor's house and tell their children. No, I can tell only my children. So Styles, apostrophe. Okay, Miss Styles, STYLES apostrophe. Symptoms. Recurrence of symptoms. Styles, recurrence. Okay, that is number one correction. No S again. So that is wrong. If you write another S, it is wrong. And no space before apostrophe also. Then recurrence, RECURRENCE. Recurrence, ENCE. That is a spelling. Recurrence. So this is the spelling. So I will copy from there and I'll paste here. Both are same. You can see that. So spelling mistakes, 3 spelling mistakes, and you lose 10 marks. Don't ask me why we will lose 10 marks again. Try not to lose 10 marks. Right. Next one. Come on. Write down some sentences. This refer has come here last. See, it should come in the forward. Urgent is here. Why? Urgent. It's urgent and you're telling in the last. After telling all the story, this is a very urgent. Huh? These two should be there in the beginning of the paragraph. First paragraph. Because urgent, they should know in the beginning. Even before reading the letter, they should know that urgent. You tell all the news and then you say urgent. What is the meaning? Okay, you should tell urgent in the beginning only so that they will react immediately. Yeah, this is another sentence. Sentence number 6. Today, Miss Stiles reports chest pain relieved by sitting up, shortness of breath, and fatigue. So now we are improving this sentence. During today's visit, okay, chest pain, comma, which was relieved by sitting up, comma, shortness of breath, and fatigue have been reported. Chest pain, which is relieved. Simple present tense, not was. During today's visit, chest pain, which is relieved by sitting up, shortness of breath, and fatigue have been reported. Passive voice. Where is Miss Tiles? Go on to the window. Why every time you want Miss Tiles, Miss Tiles, Miss Tiles? Crazy. When you can use without Miss Tiles, why you want to take the name of Miss Tiles? Learn, na? Learn how to avoid the name always. It's a negative point. Repetition of name many times is negative. Sangeeta Patel, sir, I am transferring in emergency department. Then is it correct organized transfer for reader? I did not understand what you are telling, Sangeeta, actually. I did not really understand what you're telling. I'm sorry for that. Forgive me, but I really don't understand what you're telling there. Sir, I am transferring in emergency department. I am transferring in emergency department. Then is it correct? Organized transfer for reader. I did not get it. Write the sentence only. Don't write everything mix up. Only write the sentence. Rewrite only that sentence which you want to write in the OET letter. Don't add other things. I mean, it's messed up. Starting with sir and then other things. No. Only sentence you write, then I will tell whether it is right or not. Otherwise, write in a second point that one. First write the sentence, then you write in another point what you want to explain. Correcting my sentence. Yeah, just to check it out. Sir, I'm transferring in emergency department. I don't know. I don't understand the sentence. You write the sentence, please. I'm sorry for that once again. I'm your teacher. So I can tell you anything. So don't get offended if I tell you anything. Okay. Suja Chellam, nursing 80. Hello, Suja. Good.
You took the one class, Zoom class 130. That ID, I didn't get it.
You did not get the ID, Zoom ID. How come you are there in the group, no?
Then how can
Okay, no problem. 1 minute. 1 minute, hold on. Okay, I'll send you the link. Wait. Where is this girl? She's there in January group. A message is sent to her. Then why she is not joining? Don't know how to train these people. Suja. Send the link. Yeah. Somebody help this girl, Suja. How to join Zoom link? Please. Somebody. Ashwini. So next sentence is sixth sentence. I gave you that sentence. During today's visit, chest pain, which is relieved by sitting up, shortness of breath and fatigue have been reported. Present tense, everything. Today means present tense. Yesterday means past tense. 1 month ago means past tense. Remember that. When you say the word today, so automatically it is present tense. So, I added her in the group. She is not following us. What I can do? Personally, I cannot tell everyone. New students, they should learn how to attend. Suja, not Suja. You cannot call Ashwini. Poor girl, she's telling, I did not get the link, she's telling. Hello, Ashwini, dear, I want a favor from you. Call this girl, Suja, and explain her how to join the Zoom session. She just called me on WhatsApp and she's telling, and sir, you have taken the session and you're taking from 1 o'clock and I missed the session. I did not get the link. She is there in the OET January group. Tell her, no, please, new students, follow them up. New students, no, they are, I don't know, they are innocent or what, I don't know. Okay. Please. Okay, for first 2 days, follow them up. Any new student is there, okay? Because I cannot call each and everyone and tell, na? मजा होते ना इंपॉर्टेंस ఉంటాయి కదా रेमका डोंट వాడికి బాడ అది కాటన్ జ్యూస్ ఏమైనా దొరికితే తీసుకురా ఏదైనా పర్లేదు ఇంతకుముందు తెచ్చినావు కదా అవి దొరికితే తీసుకురా లేకపోతే ఒకటి అవి మురుకులు ఉన్నాయి చూడు అది ఒక 3 కిలోలు తీసుకురా ఒకటి అది షకినాలు ఒక 1/2 కిలో అన్ని కలిపి ఒక 3 కిలోలు కావాలి డబ్బులు నేను పంపిస్తాను ఖర్జా అది ఉంటే చూడు వీళ్ళు చేస్తారు చూడు పండగ బెల్లంతో చేస్తారు చూడు గుండ్రం లాగా చేస్తారు కదా మనం తిన్నాం కదరా నిన్న వీళ్ళకి పెట్టించినారు తిన్నాం కదా అప్పాలు అరిసెలు షకినాలు అన్ని చూడు ఫొటోస్ పెట్టు నాకు నేను చెప్తా ఎన్ని కిలోలు సారీ I'm trying to leave here, so that's why I'm asking him to bring some sweet meats. Suja offline, sir. What to do with these people? Just now she called, she's offline. She's telling she's offline. Yeah. No wonder she called and she went offline. Anybody is there from there, just to call Suja and message her them directly, okay, please. Please follow them directly. Tell them. They are trying to contact them and they are out of. Called me and went off. Yeah, who is there? Yeah. Okay. Please inform Suja. Thanks. Yeah. Okay. Right. Fine. So during today's visit, chest pain, which is relieved by sitting up. Maybe she disconnected and kept. That's why she did not get a link. Suddenly she called and she switched off. No. Okay. The next one. So what is this? What am I doing? Yeah, please follow it up with them. During today's visit, chest pain, which is really, okay, this is done. Next sentence also we'll take from here only. She has low-grade fever. These things. Okay. Now this is one sentence. She has low-grade fever. Okay. So upon examination, she has low-grade fever, tachypnea and tachycardia 150. Okay. A low-grade fever, low-grade hyphen, low-grade fever. She is, remove she is, comma, low-grade fever, 38.1. Anything is there, you can write like this. 38.1 degrees centigrade. How to put this degree now? Okay, I'll put this only, copy paste better. Okay. Screen not clear, Sangita. Okay. 38 point. So you can do one thing, you can exit and join again. You exit and join again. Rejoin. A low grade fever, start from here. A low grade, she has removed. A low grade fever, comma, 38.1 degrees centigrade, comma, tachypnea, 28 BPM, 28 BPM, beats per minute, 28 beats per minute. Oh, tachypnea, 28 beats per minute, and tachycardia. Okay, 115 beats per minute. Okay, have been registered. Okay, so these have been registered. Okay, in addition to blood pressure, that also you can say. No, okay, that will put a full stop, will not extend too much. Okay, full stop. That is sentence number 6. 7. Sentence 7. Sentence 7. Okay, that is sentence 7. Then sentence 8. Sentence 8. Sentence 8. Okay. These are all sentences. Okay, learn these sentences. It will be useful in, if you learn these things, you will get 400, not 350. You'll get 400. Okay, learn properly. Our blood pressure is 125 by 78, which is lower than. Okay. Her blood pressure lower than her usual. Why so many times her? So our blood pressure is, okay, active voice. So why don't we change it into a passive form in a different style? The blood pressure okay, the blood pressure at 125 by 78, which is lower than the usual 140 by 90. Okay, the blood pressure at 125 is India, which is lower than the usual 140 by 90, has been recorded. There we wrote registered, here we wrote recorded or noted. Registered, recorded, noted. When you take measurements, you can use these words: registered, recorded, noted. Okay, in the book or somewhere, noted, registered, recorded. The blood pressure at 125/78, which is lower than the usual 140, lower than the personal usual. Okay, usual 140 by 90 has been recorded. So this is the way. There is no she, there is no her. Okay, avoid these things. She, avoid these things as far as possible. Okay, so 8 sentences we have seen. Now we'll go to medical letter. So Mr. Knowles has lost. Okay. So question, sentence number 9. Sentence 9. Sentence 9. Mr. Knowles has lost 2 kg over the last 4 weeks. Mr. Knowles has lost 2 kg over the last 4 weeks and his abdomen is slightly swollen and tender. So 2 kg, how it will be written? So 2 kg, how it will be written? Kg, kilograms, how it is written? Example sentences. Kilograms. Nothing is given. Meters. Sentence example. Abbreviation for million. Meter length. Yeah. 1.8. See here, every time I'm correcting, na, this is what you have to write. After 1.8 space, then M. 1,500 meters. In OET letters, they are giving like that one. That doesn't mean that it is right. Okay. Okay, I'm not questioning OET. Deranged blood pressure. Yeah, correct. Deranged blood pressure is correct. So 1,500 meters. But in OET letters, you will see with no space here in between. You will not space any. Yeah. Sangeeta, is your screen clear? Deranged blood pressure. Yeah, it is correct. Next. So 1,500 meters. You see how it is written here. So whenever you have a screen, don't say screen is not clear, just to go out. If screen is not clear, everyone will shout at me there. So if nobody is shouting and only you are telling, means problem is only for you. So like this one, you have to leave space like this one. See, just now I corrected here. Every time I'm correcting. Okay. So, right, you have to understand why I am correcting. This meters. See here, 2 kg. I corrected 2 kg. And other places also I corrected many places. What is that? Milligram. I gave space, but in official OET, see 500 milligrams. See 300 mg, 30 mg. See no space, but there should be space like this one, like this one. Okay, right, like that one. It's important. Okay. So every time I correct like that. So I have shown you because I wanted to show you. I have shown you. So check once again. 1,500 meters. So space after 0. And here 1.8 space after 8. See there. Okay. So you should understand the importance of space. Then next one. Body weight was noticed has decreased. Body weight decreased. Weight loss of yeah. Number 9. Okay. Yeah. Mr. Knowles. Why writing Mr. Knowles again? No need this many times. Why? Has lost 2 kg over the last 4 weeks and his abdomen is slightly swollen and tender. He is slightly swollen. His abdomen is slightly swollen. See, all active voice, active voice, active voice. So here, how can you write? Weight loss of 2 kg over the last 4 weeks. Now what I will do is over. Instead of over, I'll say during. During the last, I'll say the previous. Don't use any word from the case notes. any word from the case notes. Don't use any word from the case notes. I'm telling you. Previous 4 weeks. 4 weeks, you can write 2 fortnights. What I wrote is the same thing. I'm writing something different. Now you see what is the difference between weeks and fortnights. Weeks. When you say week, it is A1, means 100 marks you will get. 100 marks you will get. If you write the word a week, you'll get 100 marks for that word. Roughly, I'm telling you the level. If you say fortnight, you will get 300 marks. A1 100, A2 200, B1 300, B2 400, C1 450, C2 500. I don't know how you take it. I'm not mad to tell you all these things. Why you want 100 marks when you can get 300 marks? A1 100, A2 200 marks, B1 300 marks, B2 400 marks, C1 450, C2 500 marks. Now you decide whatever you want. So don't use the same words which are already there in the case notes. See how I am playing with the words. In, over, during, the last, previous, or earlier, the recent. Any word I can do. 4 weeks, 2 fortnights. Now why I changed? You will not use like that one. Nah? A period of 2 weeks is called a fortnight. That much knowledge you have. It doesn't mean that you don't have. You don't have. But you are not wise enough to use that knowledge which you already have. That's the problem. You are not wise enough means what? You understand what I am telling you indirectly. Okay. Mere knowing is knowledge. Mere knowing is knowledge. Mere knowing is knowledge. Somebody from Nigeria, they have quoted this word and they have put it as sentence in the status. I noticed one time. Mere knowing is knowledge. Practical application of knowledge is wisdom. Underusing, overusing, misusing, and abusing knowledge is foolishness. Underusing, overusing, misusing, or abusing knowledge is foolishness. That's fact. That's the fact. This is a quotation from Peterson. So, you have knowledge. You have knowledge, but still you are not using. It is equal to not knowing. Nah? Why you are not using? That means you are not being wise. That means you are not wise enough to use that knowledge. So use that wisdom, use that knowledge, and that will convert into wisdom. Okay. See, 4 weeks is there. You write 4 weeks. Then what happens? What happens? You will get marks for weeks only, na? 100 marks. Fortnight. A period of 2 weeks. That means you are applying your knowledge and modifying it into a special style. That is called quality enhancement. I don't know whether you agree or not. That is your problem, not my problem. So B1. B1 means what? A1, A2, B1. A1, 100, A2, 200, B1, 300, B2, 400. And C1, 450, C2, 500. That's it. So previous 2 fortnights, weight loss of 2 kg during the previous 2 fortnights, and slightly swollen and tender abdomen have been notified, informed, reported, notified, informed. Okay, weight loss of 2 kg during the previous 2 fortnights. He only told, no? How do you know? 2 weeks, 4 weeks, what happened? How do you know? He only told earlier 4 weeks back, this was my weight. Now this is my weight. He only told. You are not measuring every day. No? Okay. And abdomen is slightly swollen. This is an examination. Okay. Okay. These two things have been notified. Okay. Or noticed or observed. Have been noticed or observed or notified or reported or informed. Whatever you want to write, you can write in your own style. See how the quality is improving. There is no Mr. Knowles. There is no active voice. There are no personal pronouns. There are no ordinary words. Week is an ordinary word. Fortnight, if 100 people are there, I cannot say 100 people. 1,000 people are there. 1,000 people are there. 999 people say weeks. Only 1 out of 1,000 will say fortnight. That's the difference. No? Show that difference and prove that you are talented. You are crazily clever. You are crazily clever. But you are not so wise to use that knowledge. It is like you buy a car and keep it in the garage. Car shed. You don't open it out. It will get rusted and spoiled. What is the use of that car? As if it is not your, not even buying. Go on the road and make some accidents also, no problem. Small accidents, not big accidents. Okay. Here you make sentences, no problem. There, if you on the road, you make accidents, problem. But here, no problem. No? You do mistakes. I'm there to help you. Maybe you might have thought yesterday, I told, sir, only 2 hours class. Yeah, 2 hours class. 4 hours class condensed to 2 hours class. But now I taken already 4 hours class maybe. Yeah. Yeah. Thank you. Right. Yeah, Suja joined. Very good. Yenna Suja? Tamila. There is Suja. Suja Riyasi. Hello, Suja. Hello, Suja.
Hello, sir.
Hello, hello. How are you? Are you fine?
Yes,
Yeah.
I am on duty.
No
Sir, I am
problem.
on.
It's okay. Good. Switch off the phone. Switch off the phone. Switch off the phone. Okay. Right, right. So the message will be sent into your group January 2023. So you have to take the link from there. If you close WhatsApp and close your data, then what will I do? Tell me. Huh? What will I do? So you have to follow that up. Okay. Otherwise, you ask somebody who is close to you. No, you don't switch off your data first of all. I was calling you and I could not get you. Okay, no problem. That's okay. You can mute back. Okay. Keep the data on always. Weight loss of 2 kg during the previous 2 fortnights and slightly swollen and tender abdomen have been notified. Okay, that is sentence number 9. Then sentence number 10. This is regarding weight loss, how to make a sentence. Weight loss of 2 kg during the previous 2 fortnights has been notified. 1. Slightly swollen and tender abdomen has been reported. That is 1. Has been. But both together, weight loss. Oh my God. Crazy. Did not check. Weight loss of 2 kg. Last title. Weight loss of 2 kg during the previous 2 fortnights. That is 1. and slightly swollen tender abdomen. This is second one. So two things are there. So have been notified. Have been notified. Okay. Right. So the next one. What happened to this girl again? She went off, Suja. Oh my God. Okay. Right. Next sentence. Okay, network is off. Okay, she's on duty maybe. Okay. Right. Mona, you type in the chat box. I will not open. Please. You type in the chat box. If it is emergency, then I will open. Yeah, Suja came again. Good. Very good, Suja. Don't go away from the class, okay? If emergency, you go, but don't go otherwise. If I tell anything also, don't get upset anybody, okay? Those who feel get upset. Will you get upset when your mother tells you something? Crazy people. When you get upset if your father says something, no. Then who am I? I'm your teacher. Then why you get upset if I tell you something? Simon Das. Okay. So 10th sentence. I typed already, sir. Please, can I clarify this too? And it is okay. This too. What is this too? I did not understand what you're telling. Or we will, but comma. We will, but comma, and I did not get you. Wait, I'll unmute you. Better. Mona, yeah, unmute Mona. Better I unmute you.
Hello, sir. How are you?
I am not fine, Mona. Tell me, how are you?
I'm fine, alhamdulillah. This only the one you wrote just now, sir. You wrote the and 2 times. Just I want
And
to be
2 times.
clear if we will put comma first and the
2
second
times.
and
Okay,
we
where
will
I
keep.
put and 2 times.
Here.
Here and here and.
Yes.
Okay.
Can we put this comma, the first one, or same with what you wrote, we will follow?
No, that is same correct only. But yeah, you have given a good idea. 2 ends are there. I did not notice. This first end, you can change. You can change the style. I will change it now.
Okay, sir. Thank you.
Very good. You have got, yeah, very good. Very good. Now I understood what you are asking. Here end is there and here end is there. Okay. So any end we can remove. So 2 ends are there. That is one end. That is 1 point. Swollen and tender abdomen is another one. This end is joining swollen and tender. But this first end is joining full first part and second part. So this is the main. This is joining both. Oh, sorry. This end is joining. This is first part. And this is second part. So these two are joined by this end. But this end is joining only swollen and tender. Okay, so they are different. So what you can do is you can remove this end. Not only weight loss of 2 kg during the previous 2 fortnights, but also slightly swollen and tender abdomen have been notified. I use not only but also. I use not only but also instead of and. Okay, otherwise I can also use like this. In addition, wait. In addition to weight loss of 2 kg during the previous 2 fortnights, comma, slightly swollen and tender abdomen has been notified. Here it will be has been notified. Okay. Then here you are using in addition to. You can use many different types. Yeah, you asked what is you are asked is correct. Okay. I did not notice that two ends. That also we have to improve. Very good point you have given. Very good point you have given. Yeah. So here weight loss of 2 kg during the previous 2 fortnights, as well as slightly swollen and tender abdomen has been notified. So like this you can write. You can write. So I have shown you here as well as. Now when you use as well as, has been notified. Let us see as well as. Let us see in Cambridge Dictionary. As well as. In addition to means singular. But as well as means singular or plural. You see here. As well as means in addition to or also. That's the meaning. So to our community as well as to our families. You see now how it is used as well as. Okay. So this is the way how you can use. That's very good. You have given a good point. So I have given 2 other sentences using the same style. So when 2 ends are coming, how to remove one end repeated. Na? Very good. That's a good point. That's a good point. Today many students are actively participating. This is what I'm telling. Na? See, maybe I'm also doing some mistakes. It's not doing mistakes like that, huh? But mistakes happen. We have to improve. Na? Nobody is perfect. I'm telling you, don't just follow me. If you have any doubts, you ask like this. Ryan Hadi added you to contacts. Why? So fine. So now I have given, see, because of this Mona, I have given 2 other sentences. So now 2 additional sentences instead of and, remove and write 3 different types. So I have given first and I used. Then what I did, I removed and, 2 ands are there. I removed and used not only but also in one, in addition to in another one, as well as in another one. So there are 3 styles you can use. You can use as well as, you can use in addition to, you can use not only but also. That's it. So 3 different types of sentences you have learned. Not only but also style, in addition to style, as well as style. You understood? So create your own sentences, write these sentences and you make your own sentences. Na? So everyone can share like this one. Uma Maheshwari, welcome to the platform. Annie, welcome to the platform. There is one more serious girl who is attending from the beginning. Anjali Dahiya. Wow. And who is this iPhone? iPhones also are learning OET now. Hello, iPhone. Phones are also learning. I thought only people and students will learn. Hello, iPhone. Say hi. Just type your name, please. I will be happy if I know your name. I cannot call you iPhone. No, that's why. Don't get offended. Huh? Okay, Annie. Hello, Annie. Not Annie. Anjali. Hello, Anjali. Dahiya. Good afternoon. Can you unmute? Okay. Anjali, yeah. iPhone, yeah. What's your name?
Suma. Good afternoon, sir.
Good afternoon, Suma. Where are you from? Karnataka?
Kuwait. Kuwait.
You are from Kuwait only. You are original from Kuwait or Indian?
Kerala. Kerala.
Kerala. Okay, Suma. Yeah, you are
Yes.
from Kuwait. Very good. Very good. So Suma is your name. And second name?
Maria.
Suma Maria. Okay. Suma
Yes, sir.
Maria. Because I cannot call you as iPhone. No, that's why I asked you. Okay.
Okay. It's okay. Sir.
Because I was surprised. Phones are also coming to learn English. No.
Okay. Sir.
Lecture is going on serious. No. So in between we want some humor. You know, humor. Okay.
Yes, sir.
Right. The next one, Anjali Dahiya. Okay, fine. So she's there from the beginning. Very good. Impressive. Normally, new students, they'll come and stay for some time and then they'll say bye-bye. Very good. They are there, interested students. Fine. Next one. See how I notice. Right. If guests only I notice, then how much I notice the regular students. Yeah. Sentence number 10. Okay. So one sentence, she has told 2 times and is there. So we have made it in not only but also in addition to and as well as. So you learn these styles. Not only but also is one style. Then in addition to is another style. And then as well as is another style. Okay. You can also use besides. Besides weight loss of 2 kg during the previous 2 fortnights, slightly swollen. That also is there. Besides also is there. Besides losing weight of 2, besides weight loss of 2 kg. In addition to, you remove and say beside, finished. There is another one beside. A lot of things I'll teach, okay? So remove in addition to and say besides. Besides, not beside, okay? Besides. Besides means in addition to, or not only but also. You can also use both and. Not only remove and say both, but also remove and. Okay? Right. So see how many different styles you can learn. So there is another style called besides. Besides. Yeah, in the event also, in the event of also is there, but in the event of is a different style actually, not to come in this category. In the event of consistent pain, some medication is prescribed. In the event of side effects, in the event of persisting chest pain, blah, 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 is recommended. Okay, like that. So in the event of is that one. Sir, will you upload the recording of this session? It is already uploaded, my dear. It's already uploaded, Suja. Right. So, next. So besides also is there. So this many different styles. This many different styles. Next. So for how many sentences I again? 9 I told, but there are many other sentences coming up. So here 4 sentences came again in between. Okay. So you learn how to modify these sentences and like this one. In addition to, as well as, besides, and not only but also. 4 sentences in 1 point I gave you. Okay. Next one. How many over? 9. So sentence number 10. So over, no, I told 3 sentences and I gave you how many? 9, 6 sentences I gave you. Too much. Enough. So shall we have another 12 sentences I told you. So shall we have another 3 sentences? You tell me. If 7 people tell, then we'll go ahead. Shall we have another 3 sentences? 10 people are there. Huh? Okay. 6 people tell yes, then we'll go ahead. 6 people are there, then we can go ahead. 1 yes, Mona. 2 yes, Maranang. 3 Maimuna. 4 Manjula. Okay. Mona, Maranang, Sangeeta, Manjula, Maimuna. Yeah. 1, 2, 3, 4, 5. How many yeses are there? So 1, 2, 3, 4, 5 only are there. I need 1 more. Otherwise, I'll stop. 1 more yes needed. Yeah. So 6, 7 are there. Okay, very good. So we'll take 3 more sentences. We'll take 3 more sentences. Very good. I am not teaching anything, okay? I am giving what is there in the OET paper. I am putting in front of you. I am not teaching anything. Don't think I am teaching. Huh? Okay, sentence number 10. Okay. Now we'll go to medical sample. See here, deranged liver function, like that one. Somebody was asking, yeah, Mira was asking, deranged something. Yeah, it is fine. Deranged blood pressure, yeah. So deranged liver function, deranged blood pressure, you can use, no problem. His indigestion has not improved. Mr. Knowles is usually fit. I would be grateful. This is done. And next one here. His eyes and skin show signs. His blood test showed deranged liver. Yeah. Yeah, let us take this one. Yeah, correct. In the event of deranged blood pressure, yeah, correct. Comma, in the event of deranged blood pressure, comma, deranged may be go up or down. Okay, blood levels go down, blood pressure. Okay. So what you have to do, you have to write afterwards. His blood test showed deranged liver function with, yeah. So his blood test showed. So start from here. Start from here. Deranged liver function with raised bilirubin and enzymes. Okay. Deranged liver function with raised bilirubin and enzymes. Start from that one because this is important. He is not important. So liver function and these are important. This is important. Deranged liver function with raised bilirubin and enzymes. Deranged liver function has been revealed. Has been revealed upon revealed by laboratory investigation. Upon laboratory investigation, on examination, on investigation, upon laboratory investigation, comma, deranged liver function with raised, upon laboratory investigation, on examination, on investigation, on observation, like that, upon examination. So upon laboratory investigation, that means blood tests. Okay. Laboratory investigation means you give a lot of tests. Okay. Right. Upon laboratory investigation of blood, test means blood, test means investigation. Upon laboratory investigation of blood, deranged liver function. See how you have to modify the words is important. Blood tests revealed. Blood tests show. So tests means investigations. So upon laboratory investigation of blood, deranged liver function has been revealed. So like that way. So quality is quality, okay? People don't how to improve the number. Sir, we cannot get more words, sir. We cannot. See how the words are increasing. When you write in passive voice. When you write in passive voice, words will be increased automatically. And only the important things will come, that also. So, same, you can write however you want to write, you can write. So, in the event of deranged liver function, something is done. Afterwards, you can say, if you want to change this one, you can use that one. Next, number 11. Sentence 11. Sentence number 11. Sentence number 11. These people don't want to go and sleep. See, many students, good. Enjoy. Enjoy. Okay. His eyes and skin show signs of jaundice. Okay. His eyes and skin show signs of jaundice. Okay. Upon physical examination, upon physical examination, comma, signs and symptoms of jaundice have been revealed or noticed. Have been noticed upon physical examination of the eyes. Okay. Eyes and skin. Upon physical examination, his eyes and skin show. That means you have examined his eyes and skin. Okay, upon physical examination. Okay, signs and symptoms of jaundice have been revealed. Write in whatever way you want to write. You add eyes and skin also somewhere if you want. Upon physical examination of the eyes and skin. You right, na? Okay. Why don't you write? Why don't you improve like this? Jaundice was confirmed with yellowish eye and skin. Okay, full stop is needed, J capital letter. It is not confirmed, my dear. It only signs. It's not confirmation. Okay, physical examination, it's not confirmed. We cannot confirm that it is jaundice. Signs and symptoms. See, signs of jaundice. Signs. Provisional diagnosis, not a, okay, provisional diagnosis. It's not confirmed. You cannot use the word confirmed when signs and symptoms are there. Okay. Next, number 12. Sentence 12. What Simon sir is teaching 12 sentences for 2 hours. People will get mad. They will get mad. Let them get mad. Nah? I'll tell you one joke. Okay, this is a joke actually. It's not a joke. It's a funny anecdote, I can say. I'll show you in the internet. I love this. I really love this. Okay. If you ask me, I give you. You do not return. You ask me. You ask me. I no give. This is funny style, okay? I no give. You get mad. Yeah, here it is. There's something is changed. The original is not there here. This is not the original one. Wait. I want to take the original China. It's not the original one. Don't get mad, get even. Okay. You ask credit. You ask credit. I no give. You get mad. Okay, this is something. Confucius, yeah. Here it is, Confucius on Twitter. Not now. Confucius, okay. So this is not complete picture. You ask credit. I give. I no give. You get mad. Yeah, it's complete. It's complete. You ask credit. I no give. You get mad. You ask me credit. I no give. You get mad. I'm asking credit. You're not giving. You get mad, no? You ask credit. I give. You no pay. I get mad. See the options here. You ask credit. I no give. You get mad. You ask credit. I give. You no pay. I get mad. You don't return. I get mad. Better you get mad. Nah? Why I should give you and I get mad? You get mad. That's it. So there are many funny instances. Okay. So learn, 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 learn. Okay. Learning is very important. See, I'm giving something different. It was funny what I have showed you now, but that's very important. That's very, very important. Upon examination of eyes and skin, the tinge of jaundice was obvious. Obvious means confirmed, no? Obvious means again confirmed. Obvious means clear, certain. Okay, so you cannot use that one. Possible, you can say. Not obvious, possible. Possibility, you can say. Okay, next one is. So this is done. So we'll close this one. Next we'll go here. Yeah, this is the last sentence. This is the last sentence. 12th sentence. Her chest X-ray was normal. Her chest X-ray was normal. If it is normal, why do you want to write here? Her chest X-ray was normal. Normal means why do you want to write about the chest X-ray? Okay. So eliminate that one. Now don't use that one first of all. Okay. Next, let us take only this part. Because that is not important now anymore. That's not important. Why do we want to write? So Miss Stiles was managed with IV saline and ibuprofen. Okay. Miss Stiles was managed with IV saline and ibuprofen. The condition. Okay. Okay. The condition was effectively managed with intravenous saline and ibuprofen. Yeah, the condition was effectively managed with intravenous saline and ibuprofen. Or you can also write like this. Intravenous saline and ibuprofen were provided. Intravenous saline and ibuprofen were provided to effectively manage the condition. So in this way you can write, that way you can write, was provided. The condition was effectively managed, or intravenous saline and ibuprofen were provided to effectively manage the condition. Anyway, it is okay. Both are passive voice. Okay. Now I want you to ask, I want you to tell me one particular question. 12 sentences I have given you, more than 12, but 12 sentences. I have given you 12 samples. Okay. Now let us see here. Do you want daily sessions in the morning or afternoon? Like this. Don't tell me, sir, don't teach in the morning, don't teach in the afternoon, teach only for 1 hour, teach only for 2 hours. Don't tell me, okay? Because I will not listen also. You just tell me if you want, you say yes, so that I'll give whenever you are available, you attend. If you say don't give me and I'll stop, means everything you'll stop. No? At least you can, if. Yeah. So that's it. If you want, again, I'll be conducting like this. Okay. Whenever I'm giving, come. Don't say, sir, you are giving this time, you are giving this time. Give me a timetable before. I cannot, because I'm teaching out of my heart. Whenever I'm happy, I'm giving. These are all extra sessions. Okay. These are all extra sessions. And yeah, these are all extra sessions. Whether you're paying or not paying, I'll give these sessions. Periodic table chemistry. For those students who are registered with me, I'm correcting the letters, I'm correcting and personal doubts, I'm clarifying everything I'm giving. So if you are interested to attend the sessions, you can message me, or you can message what's this girl's name, Ashwini, in the group. So she will guide you, and whenever you get the link, you can join. Okay. And if you want regular corrections and regular speaking practice, then you can register. Okay. Already finished admissions. Only one admission is there for nursing. Yeah. So I want your feedback regarding the sessions today. So you can give your feedback. So grade the sessions. Grade the sessions, how useful it was. Okay. Grade the session 0 to 10. 0 is the worst lecture ever, and 10 is the best lecture ever. Don't need to please me. Okay. Do whatever you want. Do whatever you want. Even 0 you give, it doesn't affect me. Okay. For you, how much useful it is, I'm asking. Not, I don't need. I know it is quality. I know definitely. How much it is useful for you, you give me. That's enough. This Mona is crazy. Yeah, keep Mona. Ishvi Soviet. Huh? Huh, Mona? Mona. How many zeros are there in 10? You don't know. Okay. Now, Maimuna, share your experience.
Yes, sir. Thank you, sir. It was very beneficial lecture. And I first time came to know how to properly construct the sentences and how to change them in the passive voice and what additions we can do. I have got the extra So a lot of words today I learned, like how to construct the sentence properly and how to start the introduction. So it was very helpful.
Okay, very good, very good. Thank you very much. You can
Thank
give
you, sir.
your feedback. Okay. Next, Mona, you can unmute Mona.
Thank you, sir, for your
Kaki
session
Mona,
today.
shui magnon le magi wagit.
I really like your way and the session and all thing you are teaching us. Thank you, sir.
Crazy
We
teacher,
know how
no?
to paraphrasing and we know a lot of thing now how to write from the case note, don't repeat. We know a lot of information today from you. Thank you, sir.
Welcome, welcome. Okay, Sangeeta Patel.
Yes, sir. Good evening.
Good evening, sir. Tell me.
I learned so many things. How to formation of this new sentence and different way. So thank you, sir.
Yeah, good. Then Nofa.
Yes, sir, it was very useful session. You just told me how we have to write in a passive voice and in one sentence we can remodel it into many ways. You just give the ideas, so it will be very helpful in my future letters, sir. Thank you, sir.
Yeah, Manjula.
Hello. So good
Yeah,
afternoon, sir.
Manjula.
Your session was really helpful for me. Like I came to know different types of constructive sentences, which I didn't know till now. And I may able to construct like sentence in one sentence, how we can make a different sentences, the different meaning of it. Well, it was very informative and I would like to join many further classes.
Okay, fine. Right, that's very good. Pass on to your friends and make them also learn like you. That's very good. Have a nice day, all of you. Bye. See you later.